All right, guys, let's get started. Thanks for everybody that's here and everybody's note takers. Anyway, I appreciate you being here. It means a lot to me. So we'll get started. I promise that this week won't be as boring as last week. Last week was kind of it was boring. Anyway, so half of it will be stuff that we kind of need to go through that you need to know that doesn't have to do with X-ray. But the other half will be something a little bit different. And then next week we'll start jumping into X-ray physics and fun stuff like that. So anybody out there, can you hear me okay?
Yeah, we can hear you.
Okay, thanks, Kate.
You're welcome.
All right, let's get started here. All right, I'm just going to switch screens here again. Just takes a second. Whoops, if I hit the right button. Okay, can everybody see that?
Yes.
All right, how about that? Can you see it?
Yep.
All right, cool. All right, so LSRT study group number 4. This is already the 4th meeting, which is pretty cool. We've learned a lot of stuff that doesn't have anything to do with X-ray. So I appreciate you sticking with me. And this will be posted to the Sterling Hub sometime this afternoon, and you guys can review this as needed. So let's get started. I'm coming from Butte, Montana today. Clinic's up and going here, and we're seeing some patients, and things are good. So all right, so we're going to talk a little bit about infection control. You know, this is something that we probably all know about. I'm just going to review it quickly. But, you know, we all know about the chain cycle of infection, modes of transmission. So direct contact. We need to know the different transmission modes of infection control. Yes, even in X-ray. We do get some people in here that are pretty sick. So let's go through those real quick. Direct contact. So direct contact, it's obvious. Direct contact with an infected person, you know, touching, kissing, whatever it may be. So droplet. Okay, here's where it gets a little bit different. Spread through respiratory droplets via coughing, sneezing, and coughing. Droplets can enter the eyes, nose, and mouth. Gross, right? Anyway, airborne. Infectious agents remain suspended in the air and are inhaled by people in the same space. That's why you need to wear a mask when you're sick. Keep those germs to yourself. Vector, it's a cool name. Insects such as mosquitoes, ticks, fleas carry infections from one host to another. So you can get it from, you know, in these areas that we live, primarily ticks, mosquitoes. Ticks are bad news if you don't watch for them. So vehicle. Infection spread through contaminated objects such as water, food, soil, or medical equipment. So, you know, we need to keep stuff clean. Wound transmission. Infection enters the body through open wounds of skin breaks. Mixed transmission. Some infections can spread through multiple modes simultaneously. You know, if that happens to you, I'm sorry. You're getting hit from all directions. Better hope your immune system's good. Vomit, which I've never understood that word. Well, it just doesn't make any sense. Vomit. Infections are spread from surface objects such as doorknobs, counters, bedding, and light switches, controlled by washing your hands frequently. So take proper precautions in all these situations. But for an exam, these are things that you need to know, and it might only be one question in the whole exam, but you need to know what these infection cycles are and what they mean. Okay. All right, asepsis. Okay, fun word. Medical asepsis refers to the practice and procedure aimed at preventing the spread of microorganisms and reducing the spread of infection. Okay. That's what we spend a lot of our day doing is cleaning up after sick people. And it's a part of our job that we need to take seriously. And, I ended up sick a couple years ago and spent 6 weeks in the ICU. And I still don't know how I got that sick, but I know it had to do with something that I didn't do properly, possibly. So this is kind of important stuff to me. So good hand hygiene, very, very important. Take care of your hands, wash them after each patient, and I think that, the stuff that you put on your hands and rub the alcohol stuff is pretty good, but I prefer to use soap and water. It just makes my hands feel cleaner and a little more free from any type of infection that may have been passed to me. Clean medical equipment on all surfaces. We know about that. We do that, but it also needs to happen in X-ray. The IR, we're always putting somebody's hand or something on the IR. Just keep it clean. Use the appropriate cleaner to clean it, and don't let us be the mode of transportation that somebody else gets sick. That includes the table, the tube, and the IR. Keep it clean. Use proper PPE, personal protective equipment. Okay, gloves, masks, primarily for what we do. Just make sure you glove up when you need to and use a mask when you need to. Very important. Use proper cleaning materials. Use a good soap. Use a good cleaner that's specifically for eliminating germs. Okay. And sterile technique. We don't do a lot of that in the urgent care. Whenever we're doing sutures or any type of procedure like that, sterile technique is important to know and how to do that. If you're not sure how to do sterile technique or haven't been taught, ask somebody. It's something important and we need to know. So sepsis continued. Okay. Proper ways to wash your hands. You guys can just look at this. There is a proper way, believe it or not, to wash your hands. Yeah, make sure you get all surfaces of your hands, fingers, fingernails, rinse with water thoroughly, dry your hands, and then turn the water off with the towel that you use to dry your hands. Take good care of your hands, guys. Okay. All right, CDC standard precautions. The Center for Disease Control is what CDC is. Again, proper hand hygiene, use of appropriate PPE, safe handling of contaminated products and surfaces. Okay. Now, we do this a lot in the urgent care. We're handling blood, urine, very rarely fecal samples, things like that. Just make sure you're gloved up and are taking care of yourself while you're taking care of your patient. So, disposal of contaminated equipment and materials. Dispose of contaminated material into proper waste disposal receptacles. Okay. Now we have red bags and we have red containers. Just make sure you're putting the contaminated stuff in the proper receptacle. That has to do with laundry, a little bit of everything. Just make sure you're not throwing something in the garbage that shouldn't go in just the general garbage. Make sure it goes where it needs to be. Needles and blades need to go into the sharp containers. Don't throw those into just the normal hazard containers. Make sure it goes into a receptacle that's made to protect us from needles and blades. All soiled linens need to be placed in soil linen baskets. That's something that we need here in Butte, is a soiled linen basket. Areas must be cleaned and sanitized with approved disinfectant, and I think we're all pretty clear on what those are, and we use them quite well. Sandy wipes, cavi wipes, they all work really well. Try to use gloves when you're using the cavi wipes or the sandy wipes. They can be pretty hard on your hands, so always use gloves and proper equipment to dispose of contaminated material. Okay, pretty standard stuff. Okay. And you all are going to pretty much know all those already. Just make sure you freshen up on those when it comes to be test time. So All right. Additional. Okay. Handling and disposal. Okay. We're going to talk a little bit more about this. Also known as biohazards. Use hard-sided containers with a lid. Container must be labeled with a biohazard symbol, usually red or orange. Keep the container closed while not adding materials. So I see this a lot in the clinics that I go into. You'll see a hazard container, but the lid's wide open. So we need to try and keep those closed while we're not filling it, and then only fill it to 3/4 the way full. You don't want to stuff them so full that you can't close the lid. So we should have plenty of those, so we have plenty of room for all of our contaminated items. So here's another one: inspect containers weekly. That could be a test question. How often do you test your biohazard containers? They need to be inspected weekly for any leaks or any other concerns. Respond to spills and dispose of and sanitize properly. Okay. You know, the MSDS sheets, which we'll talk about in a little bit, for every chemical that we have in the clinic, there's a section that tells you how to clean up a spill of that product. So we need to follow those guidelines when needed. Hopefully we're not spilling a bunch of stuff everywhere, but if you've ever been around me, yeah, I spill stuff sometimes. Anyway. So yeah, make sure we're cleaning stuff up properly, and those can be found in the MSDS sheets. So, which is usually in the lab. Let's see. Waste materials must be picked up and disposed of by a state-approved agency. Okay, that's not something we can just run and throw in the dumpster. That needs to be picked up by somebody that specializes in waste disposal, and I think all of our clinics are set up for that. But again, that could be a test question as well. Who needs to dispose of a biohazard material? And it's in a state-approved agency. Okay. Biohazard materials are usually incinerated or buried or recycled. I didn't realize that I knew that they incinerated stuff. I didn't know that they buried them in a landfill or recycled at the same time. But let the biohazard company take care of that and do what they do with it. So just don't throw stuff in the trash that doesn't need to be there. Okay. MSDS sheets. We've talked a little bit about those, and you know the information that is contained in those for every chemical is the toxicity of the chemical, how dangerous it is to inhale or come in contact with. A flash point, how that stuff burns. Some of that stuff has a high flash point. Spill and leakage cleanup procedures, storage guidelines, exposure control, protective measures, what you need to do to protect yourself from that chemical, and safety precaution for handling, storing, and transporting chemicals. You know, those MSDS sheets just kind of sit up in the cupboard and you don't think much about them. But keep that in your mind next time you spill something or need to find out what kind of chemical it is, that those are there for our protection, and they need to be used as such. So, okay, now believe it or not, that's the end of the non-X-ray stuff that you need to know. So for the rest of the time, basically, we're just going to go over some kind of cool X-rays and talk about them a little bit, a little more interesting stuff. I appreciate you guys bearing with some of this stuff because it is kind of mundane and stuff that you may already know. But you know, when it comes to be test time, just look back at these and refresh your mind on the non-X-ray imperative stuff. So, okay, we're just going to go through some X-rays. It shouldn't take very long, and you can get on with your day. So, okay, now, if you were to title this, it would be "Don't Hide Your Engagement Ring in a Milkshake," maybe. So this young lady probably swallowed the ring before he even knew it. Anyway, how would you feel if you were the guy? Man, I feel terrible. Well, you're going to get your ring in 2 to 3 days. So anyway, so yeah, pretty diamond ring in the stomach. Kind of cool. We see stuff like that in X-ray sometimes. So, all right, here's a stabbing victim. This actually illustrates the reason why we take two different views, say an AP or a PA and a lateral. because you look at the lateral picture and it looks like that knife is sticking right into that guy's head, right? But you look at the AP picture and you can see that it kind of slid off to the side, which is, or maybe it is into the temporal lobe there a little bit. But that is the reason we take two different pictures, so we can get two adjacent views and see where something is exactly. That's why it's important that we take all the views that are mandatory for us to take. So, hey, poor guy. Dang it. Okay, fireworks. We're going to talk about fireworks safety. Okay, I read about this in a little bit. This guy was holding two M80s in his hands, and it actually blew up before he could dispose of them properly. And pretty interesting X-ray actually. You've got two hands that are completely away from the arms at this point and totally blown up. If I was an orthopedic surgeon and I saw this, I'd probably turn around and go home. Chances of this guy keeping his hands are probably not very good. Kind of a cool X-ray though. In my career, I've seen some X-rays like this, but it's very interesting some of the injuries that people and predicaments that people put themselves into. Pretty cool picture though. Okay, this feller or lady, I don't know what it was, cleaning their teeth with some scissors. And how do you accidentally swallow a pair of scissors? I don't understand it, but anyway, this guy swallowed a pair of scissors and it's caught in his esophagus. I would guess that they went in there and pulled that out surgically. I don't think that's going to pass anywhere. Yeah, just be careful what you clean your teeth with. Here's another M80 accident. And M80 is a huge firecracker, basically. Has a lot of power. This is before and after picture. It did a lot of damage to this feller's hand. And again, I doubt this guy kept his hand. But some of these guys are pretty wizardly when they get to surgery and can put stuff back together. But my goodness gracious, what a terrible injury. Really kind of cool. Stabbed with a knife. This is actually a CAT scan scout image. So you take an image with your CT machine and then you're able to set your scan up from this image. And you can see that the knife perforated the right lung right here. And you can see that there's no air in the lung at all, which means that lung is definitely collapsed. And it looks like it may be touching the heart. It's kind of hard to say without a lateral picture. But yeah, it looks like a pretty gnarly pocket knife. Anyway, pretty sad image, but cool at the same time. All right, so pregnant dog. This is kind of a cool picture. We don't take pictures of dogs. Well, I take that back. I have taken a picture of a couple dogs in the urgent care setting. Sometimes in rural health, you do stuff that you got to do. So anyway, you can see probably 8 dogs in that dog's belly. It's kind of cool looking. You can see head and spine and tail and ribs. Pretty neat looking though. And girls, stilettos, man, I don't get it. That's gotta hurt if you're in those for too long, right? That's a lot of pressure on your toes and the head of your metatarsals there. So yeah, kind of cool picture though. It shows the stiletto and how a foot sticks into the stiletto. So all right. So now I've taken 3 of these pictures in my career. They were all in an ER setting. They're sex toys. I don't know how else to put it. But sometimes those suckers will get away. And I had a young lady, well, it was a couple actually, come into the ER when I was working in Arizona. And, they were really funny about things. She was complaining of abdominal pain. And she really didn't say what was going on. So I got her on the table to take a KUB, and I was palpating for the top of her hip, and I could feel vibration on her belly. And I said, so what's really going on? And she proceeded to tell me what was going on. And, I do have a copy of that picture I'd like to show you someday. It's actually right up against the diaphragm, and they had to surgically remove it. But in this case, it looks like they tried to remove it themselves at home with a pair of tongs, and the tongs got stuck. So here they are in the ER. So, and I'm not sure what this is up in the left kidney area. I'm not quite sure what that is. Maybe she swallowed a quarter or something. But yeah, interesting picture. You see these every once in a while, and hard not to laugh a little bit, but can be serious injuries. So, all right. Okay, this person fell on ice, went hit the back of their head. This is a pretty gnarly skull fracture. Usually it's just a crack. Here it's totally comminuted, and I would imagine this patient's in pretty bad shape. Neat picture, however. Diverticulitis. Okay, this picture looks like it was taken post a CT or something where they use oral contrast. And when I say oral contrast, it's a liquid that you drink that makes your small bowel and your large bowel show up a little bit better on a CAT scan. And we used to do X-ray studies on these all the time, and they're pretty neat actually. But as what's happened here is the contrast is evacuated bowel. And if you know what diverticulitis is it's a small out pouch that develops on your bowel, and the contrast is actually retained in this picture. This person has a pretty bad case of diverticulitis, and it can be painful, and feel sorry for the person, but kind of a neat picture anyway. So massive kidney stone. That's one of the biggest ones I've seen. I've seen a lot of big kidney stones, but this is a big one. If you look close, you can see the outline of the kidney a little bit right there. And that person is not going to pass that stone. That's way too big to get through a ureter. He's been developing that for quite some time. I would imagine that they took that guy and used sound waves to break it up and pass it. That's big old kidney stone right there. Kidney stones are cool. They're not fun, but they're cool to look at. So pneumonia. This is a terrible case of pneumonia. You'll see that the left lung is completely enveloped with pneumonia. And this is what I was in the hospital for, something similar to this. And it's not cool. So, but these are neat pictures to look at, and they're educational. Most of the time you'll have a little bit of clouding down in the lower lobe of your lung or in the mid-level. But here this left lung is completely enveloped with pneumonia. Pretty sad case. I imagine this patient was hospitalized for a bit, so that cleaned up. Usually is what they do. Well, is what they did with me is they did anyway, they went down into my lung through my breathing tube, and they went in there with a kind of a vacuum type thing and cleaned a lot of that up, which keep redeveloping. But that is a method that they use, is they'll go down there with the scope and clean that up manually, which helps. So, okay, pneumonia, not good. Okay, these pictures are really neat. These are my favorite pictures. We don't do these very much anymore. We certainly don't do them in the urgent care. But it's a dual contrast bowel study. So is what you do is you have the patient drink a bunch of contrast. You give them a couple hours till it's in the bowel. You have them evacuate as much as they can, and then you use a anal catheter, which isn't fun, and you pump them with some air. So this is an air contrast study, and they're actually really pretty. You can see the entire bowel there. You got your ascending and your descending colon here, both transverse colons, and pretty neat looking. It shows the folds and what's going on inside the bowel. And they used to do these all the time and they would find cancer and stuff like that through doing these studies. But you can see that the transverse colon dips way down. You know, you'd think that your colon is always in an upside down horseshoe, but that's not the case. Anyway, pretty neat study. You can see it come down like this into the colon right here, and very uncomfortable study, but they're very, very pretty. Uncomfortable for the patient because you're full of air. So anyway, cool study. And those are the only x-rays I have for you today, and actually the only information I have for you today. I tried to make this in a little bit shorter. How the heck do I get that here? Anyway, there we go. Anyway, I tried to make this in a little bit shorter for you guys today, just because last time was so long and kind of mundane. But next week, we're going to get into some x-ray physics and, you know, the nuts and bolts of how x-rays are produced. And it's actually going to be really interesting and kind of neat to see how somebody actually come up with that. And I'm excited to talk to you guys about that. And I appreciate you guys being here today, and I hope you guys have a great rest of your week. I don't know if I'll be able to get a positioning video out this week. I am in Butte, and we'll see if we can get put together. But next week, certainly we'll get back with the positioning videos. We will definitely see you next Wednesday when we'll talk about some X-ray physics. It's gonna be awesome. Don't let physics scare you, especially not with X-ray. It's a little bit complicated, but not like high school chemistry or college chemistry or physics. It's nothing like that. So anyway, it's going to be cool. So we'll see you next time. Like I say, if you guys have any questions, you get stuck on a study, give me a call. We can walk, or I can walk you through any study you want to walk through. I've had a couple calls from my home clinic today, and we walked through some studies, and it works out great. You get good pictures. So if you're ever confused on something or stuck on something, 9 times out of 10, the patient isn't going to mind if you're on FaceTime or just talking to somebody to get through the study. So I appreciate those phone calls. Anyway, thank you guys for coming today, and we'll see you next week.
Thank you, Eric.
You're welcome. Okay, see you guys.